Welcome to In Focus, Texas. I'm your host, Carla Leal. April is Cancer Control Month, a time to raise awareness of the risk factors, expand affordable treatments, and promote screenings. The deadly disease is the second leading cause of death in the United States. Here in Texas, it's estimated nearly 140,000 people will be diagnosed with some type of cancer this year. That's according to the American Cancer Society. This week, we'll learn about the importance of healthcare access and how the state is investing in life-saving research to prevent future illness. Cancer is the leading cause of death for Hispanics in the U.S. This according to the American Cancer Society. Research shows South Texas has some of the most cancer-prone areas. Our Brian Bowes spoke with a cancer survivor who is sharing her story to raise awareness.
Come on.
I will.
Dina Ortiz is all smiles now.
Who's this?
That's Kitty. We call her Kitty.
Wow, creative. He went real creative with the name there.
But there was a time when things weren't always so jovial.
I was really scared. It was like I didn't know what was going to happen at the end of the treatment or how far was I going to make it.
Now cancer-free, this mother of 5 and grandmother to 17 is back to living her life. But she's certainly not worry-free. As a Latino, that concern is genuine.
Other studies have pointed that cancer is going to increase by 142% by 2030 among Latinos.
That's Amelie Ramirez, doctor of public health at UT Health San Antonio, who's bringing together researchers, scientists, physicians, and many more under one roof to develop goals, develop a plan to eliminate these cancer disparities.
We decided, hey, let's start bringing Latino researchers together to find out if we can help resolve some issues for our population.
It's welcome news to Dina,
My daughter's best friend, but she was like a daughter to me.
whose family has been affected by cancer,
She just died in June.
as well as her friends.
Seems like everybody I find on Facebook that I know that went to school with me, either not them, their sister, their mother, everybody's coming out with it. And I'm like, wow.
But she says it's not a case of too little too late, but better late than never.
Hopefully that more people get awareness of it and talk to their doctors more and get a little more information, and maybe it could help them out like it helped me.
Caring for cancer patients requires discipline, dedication, and compassion. Medical oncologist Silvia Jaramillo from Texas Oncology North Austin knows this well. Dr. Jaramillo, welcome. While you treat patients diagnosed with different types of cancers, you also work to educate underserved communities about this disease. Tell us, why is community education and awareness on cancer care so important for all Texans?
It's so important. Ever since I became a doctor, I realized how important education was. And if we can teach our patients how important it is to have regular follow-up with their doctors and get the screening that they need, we can often catch cancer at its very early stages and achieve higher levels of cure when we do follow these recommendations.
What type of health disparities do Texans face when it comes to cancer care?
A lot of it is focused on access. And so, of course, a patient's socioeconomic status can affect that access. There could be language barriers, insurance difficulties, and then actually navigating the healthcare system, which can become very complex. However, we're learning in oncology that it's much more complex than that. There's actually different differences in patients' cancer, right? So if they're from one racial background or ethnicity compared to another, there are differences in cancers that we're finding, and we really need to study those. And that's why it's so important to perform clinical trials across the population in order to understand those differences so that we can better guide therapies.
Dr. Jaramillo, tell us, when people are diagnosed with advanced stages of cancer, what are some of the options available to help them improve their quality of life?
So when a patient is diagnosed at an advanced stage, there are so many therapies that have proven to not only help the longevity of their life, but also the quality of their life. So just because a patient gets diagnosed at an advanced stage, it doesn't mean that we can't necessarily treat them. In fact, our therapies have improved so much, and our supportive measures have also improved so that we can treat the patient but also help improve the quality of their life. Oftentimes, these advanced tumors are producing problems and pain and issues in the body that your doctor, your oncologist can help navigate so that the quality of the life of that patient's life is improved.
What type of questions should cancer patients or their relatives and caregivers be asking to their physicians to better navigate their diagnosis?
So I definitely think that when a cancer diagnosis affects a family member, it's really important for the family to all join together and to participate in those medical visits. It's important to write down questions that they have about their diagnosis. And then when they start getting information about their treatment, to really make sure that they understand what is presented to them. Oftentimes, if there's a language barrier, I think it's really important for patients to have an interpreter, a certified interpreter, so that they understand, line by line as the cancer care plan is presented to them. A lot of times patients feel overwhelmed, and sometimes additional visits are needed so that patients can understand the rationale behind the treatments.
I know that part of your work also specializes in caring for the Latino population. What trends are you seeing related to cancer on that end?
Yes, so, unfortunately, one of the most startling stats that I've seen is that the U.S. Hispanic population, Latino population, is expected to face a 142% rise in cancer cases in the next coming years. And so this is a huge challenge that our Latino population will face. There are many cancers that, can be prevented, like I said, at a screening basis. Cervical cancer, for example, very important to screen with a pap smear. Mammograms done on a yearly basis. So I definitely think that the Hispanic population has a huge, wave of, unfortunately, new diagnoses that are coming in the next few years. So the challenges that we face, I think, also from a biology standpoint, is understanding how these cancers affect the Latino population differently than other populations.
Dr. Jaramillo, thank you for sharing all this important insight and bringing that awareness and reminding us that cancer screening and prevention, all those prevention measures are vital to our health.
Thank you. Thank you so much for having me today.
Next, we'll show you how a new targeted therapy could be an alternative treatment for cancer. Welcome back. A South Texas Cancer Center has saved countless lives here in the Lone Star State, and soon they'll continue their mission around the world with 2 new locations in Europe. Our Blessing Iwachuku introduces us to a woman who's experiencing their groundbreaking research firsthand.
2022 wasn't looking too good for Judith Burton.
Just to your comfort level.
She was diagnosed with cancer in late August of 2018.
Endometrial primary peritoneal carcinoma.
But it wasn't until mid-May when her health took a turn for the worst and she ended up back in the hospital.
All the things that were happening at once to me at that time could mean that I really didn't have a very few months left to live.
That's because the chemotherapy she was on at the time wasn't making a difference. At this point, she had already tried 4 different types of chemo.
It's difficult. When you watch someone you love so much, and we just celebrated 40 years this October, when you see someone you love so much in pain and hurting, it's, as a man especially, it's hard because, we're supposed to protect, we're supposed to be able to take care of them.
Now she's under the care of Dr. Amita Patnick at the Start Center of Cancer Care in San Antonio. Judith has been part of the clinical trial there for the past few months.
We have close to a dozen ADC studies right now, and for Miss Burton, based upon her tumor type, we knew that there was a high likelihood of her having a specific type of target that was the focus of one of the ADC studies that we were conducting, and that particular ADC study was selected for her.
ADC stands for antibody drug conjugate. Dr. Patnick says it's basically a targeted approach to attack cancer cells without impacting healthy tissues in a patient, like how chemo can cause hair loss and other tough side effects for some patients.
There are 3 ADCs now for breast cancer. There is one for cervix cancer, there's another one for bladder cancer, and just on November the 14th, the FDA provided accelerated approval for an ADC for certain subtypes of ovarian cancer. We think that this is transformative.
2022 may have started a little rough for Judith.
It was starting to get to a point where we were getting discouraged.
But 2023 looks a lot brighter.
You're very welcome.
Leaders at the state capitol are working to make sure Texas is part of the mission in the fight against cancer. Joining me now is Representative Terry Canales to talk more about this. Chairman Canales, welcome. How is cancer care and prevention being addressed at our state legislature?
Thank you for having me. So I kind of go back in history for you. In 2007, we created CPRIT, which is the Cancer Prevention Research Institute of Texas, and we invested about $3 billion in the state's unprecedented fight against cancer. Again, in 2019, voters overwhelmingly approved a constitutional amendment to continue CPRIT's work, adding another $3 billion. And so finding the best cancer research and prevention opportunities in the state of Texas is our goal, and CPRIT is at the heart of that goal.
Share with us what type of cancer-related issues are your constituents bringing up to you?
So in the Rio Grande Valley, we actually have, where I'm from, which is deep South Texas, we actually have one of the greatest incidences of cancer, a larger percentage than the entire nation. The University of Texas Rio Grande Valley has a school of medicine, and it is also in the fight or the efforts against cancer, try to identify different communities with different cultural and DNA backgrounds have different problems with cancer, and so those are the things that we see in my area of the world.
And now that you're mentioning UTRGV, they were recently awarded a grant that also continues to aid them in their cancer research. So how important is this grant for your district and the rest of Texas, and what do you know about how they'll be using that money?
So we got a $6 million grant for operations to accelerate cancer research at the university, and they're going to be using it to identify the things that we see in our community. I'll give you a great parallel. Is during COVID, much of the research that was done in the Rio Grande Valley was the stuff that was shipped to places across the nation, like Los Angeles, Chicago, for different aspects of treating Latinos. Because what we've realized is certain drugs work on Latinos that don't work on Anglo-Americans or African-Americans. And so the Rio Grande Valley, being predominantly Hispanic, is an amazing testing ground for pharmaceuticals and treatments for Hispanic people that can be shared throughout the nation. So that $6 million is going to go a long way to not only helping the people of the Rio Grande Valley, but helping all Hispanics across the state of Texas or people that have Hispanic backgrounds.
Well, Chairman Canales, you just brought it up. You oversee a diverse district where many of your constituents don't speak or dominate the English language. What type of resources are available for them to learn about cancer care?
Unfortunately, there's not a lot of resources available, and that's why this money is extremely helpful. The Rio Grande Valley is at a disadvantage when it comes to specializations across the board, from DNA sequencing to pharmaceuticals, to many different aspects of access of healthcare that other regions of Texas, for instance, Dallas and Houston, have that we don't have. And so the fact that we're able to participate with CPRIT and that we're being identified for the first time as a place of extreme value when it comes to information and studying, but you need to run clinical studies, or you need people that are sick, and then you need the people that you're studying. And so when we're talking about studying Hispanics, there's not a greater place that it can be happening. And so being able to play a part in that, and it highlights the importance of the region, because Hispanics have the highest rate of death, the highest rate of disease, the lowest rate of education. And so if we don't start to focus, and comorbidity, they have the highest rate of comorbidity. So if we don't start to focus on the necessity of the Hispanic community, the workforce that's about to take over the entire state of Texas as the majority population will be one of the sickest, one of the most uneducated, and one of the most underfunded and underappreciated. And the reality is that this effort that's kind of associates this CPRIT effort only highlights the fact that the state is beginning to recognize the importance of the Hispanic community and making sure that we take care of the workforce that is destined to take over the majority.
Chairman Canales, thank you for sharing all these insight with us. Traveling back and forth for treatments can be hard on cancer patients and their caregivers. Coming up, how one organization is working to make that process easier for them. We're back. The American Cancer Society is well known for its research, advocacy, and preventive care work, but it also aids cancer patients during and after their treatment. Aaron Cox is the American Cancer Society of Texas Central and South Region Director and our final guest in this show. Aaron, thanks for stopping by. As someone receives a cancer diagnosis, a treatment schedule comes shortly after, and it's not uncommon for patients to face challenges. How does the American Cancer Society help cancer patients that travel away from home to get the care that they need?
Absolutely. So first, thank you for having us. We're excited to be here. And for a person who's traveling away from home to receive care, there are many options, but the one that is most critical in our area is Hope Lodge. Hope Lodge is one that we provide across the country and specifically here in Texas. It is 30 plus facilities located across the country in strategic areas near cancer centers where folks can go, and it's their home away from home, really providing the comforts of what they know, private suites with private baths, and some features they may not have at home, like healing gardens and chapels, but really a place where they can come, they can walk, we can alleviate some of the financial burden associated with cancer treatment and with traveling away from home, and yet have access to those things. So whether it's a living room, a private bath, a snack pantry.
All of those things are so important because it's such a sensitive time, such
Absolutely.
a difficult time for the patient and their families. How many Hope facilities does the American Cancer Society have here in Texas? Are there any new in the works?
Yeah, absolutely. So here in Texas, we have the most Hope Lodges of any other state in the country, as you might imagine, because we're Texas. But we have 3 right now in the state of Texas. There's one in Houston, there's one in Dallas, and there's one in Lubbock. We have just kicked off the capital campaign to build our 4th, which we are very excited about. That will be located in San Antonio and will serve San Antonio South and, of course, anyone from across the country. But our main focus is Central and South Texas with that one.
And I know another resource the American Cancer Society has is a helpline. What type of support does this 24/7 line provide to cancer patients?
Yes, so the 800 number is really a resource for cancer patients and caregivers alike. So if you have questions about your diagnosis, we can help you with answers there. If you have questions about accessing services or treatment, we can help you with there. It is really just a comprehensive line for questions about the cancer journey.
Aaron Cox, thank you for sharing all of these great resources.
Absolutely, it's my pleasure, and thank you.
Earlier this year, the PGA held its 7th Dell Match Play tournament in Austin. This golf match brings in millions of dollars for local foundations like Dell Children's Hospital. Our JJ Maldonado shows us how some of those funds are used to help young cancer patients receive care close to home.
It's the first couple months were a little hard. They were tough for me.
Jackson's journey with leukemia began last September.
It's just a long journey that he's in the middle of right now, and he's persevering. We're getting through it. Medication and the team is doing what they need to do.
After overcoming struggles and treatments, Jackson is fighting the odds with the support of his family and medical team.
But I know now that the people here will take care of you. They'll help you get through it.
Jackson's family from the Austin area says they're blessed to be able to receive care so close to home in Central Texas. Recently, he helped dedicate an opening of a room he's been in often when visiting with doctors. The dedication of the room funded by the PGA Tour and the Dell Technologies Match Play. The mural offering interactive games while young patients wait to see their doctor.
Our hospital became a beneficiary of Dell Technologies Match Play in 2020. Since then, the tournament has raised over $1.4 million for our Here campaign for growth.
According to the organization, the Match Play has brought in more than $6 million to local charities in the Austin area.
Gosh, I can only imagine that the legacy that Dell Technologies Match Play has left will continue to grow. The generosity of the golfing community and the generosity of our community at large.
Despite the tournament not coming back in 2024, the organization says this year's event will see Dell children as a beneficiary of charitable funds. Funds that will help patients like Jackson get back to what he loves doing the most, playing sports.
That'll do it for this week's In Focus Texas. I'm Carla Leal. Thanks for joining us to take an in-depth look at the fight against cancer in the Lone Star State. Take care, and we'll see you next time.
Thanks for watching our YouTube channel, and for more refreshing stories about your community, click the subscribe button right over here. You can also download our Spectrum News app to get live news coverage, weather alerts, and more wherever you are. And don't forget to tune in to Channel 55 on Dish and DirecTV for live local reporting every single day. We'll see you then.